My name is Dace Baltiņa. I am a medical oncologist and a specialist in palliative care of cancer patients. My experience is 35 years in what we call real-life oncology. I'm dealing with patients. I'm working also as a professor at the university, Strategic University. I'm teaching students in oncology. I'm also the main specialist of oncology at our Ministry of Health. And finally, I'm medical advisor in this particular company. Infection agents are present in nature. We know there are a numerous count of bacteria, viruses, but we should also remember the dual role of viruses they play in preventing cancer. Viruses may cause certain disease, but viruses could be used to provoke our immune system. It is a natural immunostimulate that could be used to treat even such diseases like cancer. The therapeutic efficacy of oncolytic viruses is determined by their ability to invoke multi-phased attack, either direct lysis of the cancer cell and viral replication inside the cancer cell, either direct cytotoxicity of viral proteins that may cause direct cytotoxic effect on the cancer cells, also induction of both adaptive and innate immune response, that's very important, vascular collapse, and probably many other mechanisms. Practically, I personally have very good experience where viruses are used together with chemotherapy, with other checkpoint inhibitors, and here we see that any drug has its own pool of action, if we can say so. And I really hope that in the future viruses will find their place in the combined treatment of different types of cancers. At the present moment, if you are looking through all the guidelines, NCCN guidelines, ESMO guidelines, guidelines of the Society of European Dermatologists, we see there is no option for patients after curative surgery of stage 1, stage 2 melanoma. Although we in Latvia, we have experience with these early stage melanoma that showed that these patients that received ECO7 virus do live longer, 4 to 6 times longer than those who didn't receive anything. Usually when I'm talking to students or to audience, I compare this with a fairy tale about 3 piglets. One piglet has a house of straw, another piglet has a wooden house, and the third piglet has a stone house. And if we compare of the cell lines, we can say this straw house is like tumor cells, and these stone house are like healthy cells. And certainly for the virus, it is much easier to get in the straw house rather than the stone house. And this idea, this hypothesis that because of tumor change, genetical environment and microenvironment, it makes tumor a very good target for a virus.